Your attendance means a lot, and we're grateful that you're here. As we begin the meeting tonight, I would like to note that this is being recorded. Chad's here recording it, and the proceedings will be available on our website, rreh.com. If there are people who aren't here tonight that would like to see it, or if you'd like to go home and review it. They asked me to note that we're the only ones that are going to be filmed, so you can ask questions and not worried about embarrassing yourselves or being on camera or anything like that. So we'll try and repeat the questions so everything goes on, but you won't be videoed. My name is Bart Barber. I joined the practice in 1998. I have a broodmare and sales practice, and haven't got over the thrill of being here. I love Kentucky, and I love being in veterinary practice. On my left is Dr. Scott Pierce. He's been with the practice a long time. All of these guys have really been my mentors through the years, and I'm grateful to be associated with them. Scott has basically a sales practice, and Dr. Spike Pierce also has a sales practice, and Dr. Bramlage needs no introduction, orthopedic surgeon, and world-renowned. We're glad to have him here with us tonight. So we'll, without any further ado, we'll turn the time over to Dr. Pierce. We just want to note that this is we're going to have a very open forum tonight. So we will want to keep the meeting moving and try and keep on time. But if you have a question that something we'd like to talk about, we'd like you to ask the question. There's a lot of concerns, especially with the new conditions of sale, so we wanted to have the meeting. And when I was in Saratoga, I heard someone say, the vets failed my horse. And I hope that is not true. As veterinarians, what we were all taught in school is, especially doing pre-purchase exams, you make findings and report those. And so part of this tonight is to help bring everyone together, that there are lesions on radiographs, there are endoscopic findings that really don't pass or fail a horse. It's really up to the buyer to make the decision what they can accept, what they can live with, and we've got a lot of evidence behind what we're going to present tonight to hopefully educate on what some of these lesions mean and what horses can live with, what they can race with, and what they can't. So everybody loves to bring up the example of the horse that all the vets failed and it went on to win a grade 1, and we're glad for that. But there are outliers in every direction. So anyway, we hope to get into some of that tonight. So we'll turn the time over to Dr. Pierce.
Okay, well done, Bart. Yeah, outliers there. That sounds a little too loud. Let's see. I guess everyone can hear me. Outliers really messed up my study in a horse that was a bad throat that ended up doing quite well at 2. So outliers are a part of the whole gig here. But let's just get started. Whoa. Of course, everyone knows that what I've done most of my career is upper airway endoscopy, along with sales work and radiology. But this has really been my primary interest and focus for the past 15, 20 years. But I don't really need to mention it to you, but pre-sale endoscopy is, as you well know, is a very brief exam at the sale. It doesn't last very long. It's an important part of the pre-purchase exam. And I'm going to go through this fairly quickly because we've got a lot of radiographic stuff to go over that's pretty interesting. But so I'll try to fly through this and not bog you down with a lot of statistical information. We examine the horse in the stall, as you all know. It's primarily used to evaluate the function and structure of the airway and used to predict the future, hopefully predict the future racing potential of the individual. Okay, before we get started, video of a normal airway. Arytenoids here, okay? Epiglottis, come back into the picture. Epiglottis down here, the little tongue-like projection there, okay? Soft palate is what the epiglottis is sitting on. Come back here, right there, okay? Epiglottis, soft palate, arytenoids, pharynx. You can see the little blister-looking things. Those are, we'll talk about those in a minute. But that's your normal airway. Arytenoids, that's your basic anatomy without getting too deep into it. I want to talk, everyone talks about these A throats, B throats, pharyngitis. These are common terminologies heard at the sale.
I'm going to try to put this in the middle because you keep going in and out.
I should have worked. Come on, Vern, sit down. Can you hear me now? Is that better? Or do you want me to hold it? All right. So we'll cover these things as we go along here. And what I've tried to do and what interested me early on was try to get away from these subjective evaluations, these A throats, B throats. It drives everyone crazy. Here's what is covered by the sales company now. You've got all these things. I don't need to list them. Paralysis. This is a weirdo that I get all the new graduates on. Interns never know this one because they're so rare. Rostral displacement of the palatopharyngeal arch. I've had, in my farm scopes through the years, I've had 3 of them in like 30 years. So that's how uncommon it is. Epiglottic, but it's bad if they have it. Epiglottic entrapment, displacement, permanent displacement. Keyword here, permanent, okay? Keep that in mind, permanent. Keyword here, severe arytenoid chondritis or chondroma. Of course, a cyst and a cleft palate. All right, first, these are conditions that you're covered on, okay? You can see this left arytenoid is paralyzed. That's normal, all right? Next, see the tissue there hanging over the arytenoids? That is this rostral displacement of the palatopharyngeal arch. It's an abnormality. There's not much you can do about it. Usually there's a cartilaginous defect associated with that. Minimal, and that's why it's in the conditions. There's very little you can do about it. We've tried to lase a few of these and try to cause regression of this tissue, but I've never had that work very well. Entrapment, okay, right here you can see this big envelope of tissue holding this epiglottis. There's the normal. And what they do, most of you know, they take the blade and cut that and free it up, and they do quite well, but it's a condition of sale covered by the catalog. Keyword permanent. You can see this horse is displaced. There's its soft palate. There's the epiglottis where it should be. The keyword here is permanent, meaning you'll have a lot of bad epiglottises that aren't permanently displaced that will meet conditions but you don't want. And then here's your chondritis, chondroma, right here. You see that thickened and enlarged left arytenoid right here. It even looks red and inflamed. There's your normal. These are tough to deal with. Not a lot of good options. And of course, here is a cyst here under the epiglottis. There's varying degrees of this thing. Some are really big, some are very small. Has a really good surgical outcome, but it's in one of the conditions. And then last but not least is this you don't see much, but you see the epiglottis here, and all this is a big cleft. And it's amazing this horse even lived this long because most of these, as you know, drip milk out of their nose as foals, and you have to usually euthanize them as foals. So you usually don't see many as an older individual. So there's your conditions of sale. What we try to do, not only with our endoscopic evaluation of the upper airway, but also the radiographs, is we try to use as much evidence-based material as we do. We try to stay away from subjective. We try to base our opinion on what's available in the research, and that's actually what led me to do a lot of research in upper airways. It was because there was really minimal research that had been performed. So what did we base our opinion? And thanks to Dr. Garrett, who took my study and Dr. Emerson's help too, and actually got it into print through a peer-reviewed JAVMA in the Journal of American Veterinary Medical Association, which is very difficult to do, but thanks to her, she did it. We looked at about 3,000 cases back through, about 4 years. So that's what we base our opinion on primarily, is this research that we performed on airways that we had had examined. Okay, why in the world would you want to scope one before you bid? All right. The sales conditions allow one to turn back for severe abnormalities, but you will see a lot of horses that will meet conditions but be very undesirable. that you don't want. We'll get into some examples here in a minute. Grade 3s, which we'll get into, grade 3s are real lazy, weak, left arytenoid primarily, that we know don't run very well. Some of those very mild ones will meet conditions that you don't want. Some very abnormal epiglottises that don't do well in training will meet conditions and you don't want. There are very few that are, I've had one that I could consider permanently displaced in all my years of practice. So permanent is a huge word. 2B airways, these are your B throats, and we'll talk about, all right? 1s and 2As, all right? We're trying to get into the 1s and 2A terminology. Those are your A throats. Makes up about 80% of horses, maybe a few more. 2A slight is 2A. 1 is perfect symmetry. We'll get into that. 2A is slight asymmetry, but it's still a very good airway. 2Bs are your B throats. Usually, you have to hold their air off to get them to maximally abduct, both arytenoids, and hold, okay? Grade 3s, and they've broken them down, all the smart guys break them down into ABCs, but I don't know what the C is, ABs. They cannot achieve or maintain full abduction. So the arytenoid cannot be maintained in full abduction. And then, of course, 4 is paralyzed, no movement. All right, here's an example of a good airway. Arytenoids, both move together. This is an A throat. Boom, pegs them, holds them. Arytenoids are maximally abduct easily off a swallow. Good epiglottis, nice serrated edge to the epiglottis. And you might note, look at this. This horse has a little pharyngitis, which is not a big deal. It's like tonsillitis in a kid. It's lymphoid hyperplasia. And so I don't get too wound up with it. As long as the airway is functioning properly, I never get too wound up in pharyngitis in babies because it's so common. Most of them have it up until 2. And you'll come into an older horse, 3, 4, 5, and the throat, the pharyngeal wall will be just pristine, clean, no polyps, no nothing. It's just as they mature, the lymphatics improve, and that all goes away. Okay, example of a 2B. Maybe a tick 3, but that's a 2B airway. Why do you not want a B throat? Okay, my 2B. Here's some numbers here. Now I put these together. See this left arytenoid? Still not up there. You can see him struggling breathing, okay? I'm holding his airway off. Finally, there we go. It's getting it up there, all right? Finally, at the end, boom, meets conditions, 2B. Now, why don't you want these? The earnings and the average earnings per start is what we've looked at. You can see the difference there. I put them all together from 2, 3, and 4 years of racing, summarize the study. Now, the significance, and I don't know why, but the significance was mostly at 2 and 4, so these numbers were more skewed then, but you can see that this is why you don't desire a 2B. Does that mean they don't run? No. By all means they run. The best horse in the 2B group was a grade 3 winner. Would I take a grade 3 winner? Certainly. But the odds are they don't do as well. They don't do as well, they don't sell as well. You go selling a horse with a 2B, people don't typically buy them. You can have outliers, they run, and it's a way to pick up a very good horse with a little less money. So it's all relative. So do I fail a 2B? No, because I've had a grade 3 winner that's won like $1 million. So there are outliers. Here you got a grade 3. Now this is a different story. Look at this left arytenoid here. The right one here is moving up, and you'll see as you go, the right one easily maximally abducts. There you go, boom, pegged it, full abduction off a swallow reflex. And the left one still never gets maximally abducted, about 50% maybe. Okay, grade 3 airways. There's your averages, 68,000 total earnings. 11, that's 2 to 4, not lifetime, 2 to 4. 68,000 average, 11,000 average per start. When you get down here, 24,000 career earnings, 5,300 per start. And what was interesting here, a horse went to Europe, and at 2, this skewed these numbers. You take this horse out, it's dramatic. One horse with this type of airway went to Europe and won $366,000 at 2, but you never heard from him again. So can they run? Sure they can run. You have outliers. So that skewed these numbers. You take this horse out, and this is like really bad numbers. So you don't want a grade 3. All right, just to go through epiglottis grades quickly. There's your normal. There's your slight flaccid. There's mild flaccid. In the study I did, all 3 of those equally performed. All right, so you can take these grade 2 epiglottises as yearlings, and they do as well as this normal one. As you go more moderate to severe, this is where you get into more of a problem where you can buy a yearling like this and they don't do as well. Comparison, okay, this epiglottis, average earnings 66,000, 11,000 per start in the normal and slight and mild flaccid. So your normal, slight, and grade 1 or grade 2 flaccids had these earnings, okay, because we grouped them together because there was no difference. You get into short flaccid epiglottises, grade 3 and 4s, the earnings are 39,000 and half. They're basically half. The same goes with short epiglottises, short flaccid epiglottises, the same. These are the type of horses you can buy. You'll end up with, will they run? Yes. Will you have some problems? Probably. They don't do as well. They don't earn as much. They run as many times, but they don't do as well. Here, okay, now quickly, here's a horse that you can buy, that you would buy, and it meets conditions, in my opinion, and you really don't want it. Look here inside here, you see, is this chondritis? Well, yeah, probably. Is this severe chondritis? No. Can you return that? No. Is that going to be severe chondritis? Is it going to respond to treatment? I don't know. Look at that right arytenoid. It's maximally abduct. The left is not there. Okay, so at the end of the exam, you do see this horse meet conditions. But this was in a recent sale here, actually in July. This horse met conditions. Would I want to buy that horse? No, but somebody did. And this was one that you would, at the end of the day, you would not necessarily like, but you had just purchased a horse. Here's another one here, just in a recent sale. You see this epiglottis, and I showed you the normal, how long and serrated and good it would look. Look at this epiglottis. Boom. It's kind of, so it's okay symmetry here. Little short flaccid epiglottis. Boom. It's gone. Displaced. Never saw it really the rest of the exam. This is the type of horse you get into training. It gurgles, has a guttural sound, and they displace. There it is there again. But this is the type of horse that performed half as well as the horses with normal and slight flaccid epiglottises. Here you go, races, arytenoid functions. You can see all of these, the A and B throats, basically started about the same time, the 1s and 2As and 2Bs. But look at the 3s; they only started about 50% of the time. So you definitely don't want one of those. So that's it. So we're trying to keep this kind of as a. In New York, we gave this, and it was really interesting to me because we had a lot of interaction with the crowd, a lot of dialogue, a lot of good questions, especially when the radiographs. We started talking about those. But so if you have any questions, please feel free to speak up. Yes, ma'am.
So the causes of the bad throats or not great throats are genetic?
I don't know if I'd go there. I don't. What I can say is I can give you breeds that typically I'm very comfortable with, or lines that I'm very comfortable with, and there's others that run more into the 2B. There's nothing proven that, to my knowledge. Larry, do you know anything?
Well, it kind of depends on what you're talking about. Not all bad throats are created equal. If you're talking about laryngeal hemiplegia, the paralyzed flap like that, you've noticed every one of them that he showed is on the left side.
Is that vaccinated? Is that from vaccinating?
No. Has nothing to do with what's been done with the horse. It has to do with the horse's anatomy. It's because the aorta is on the left side in the chest, and the nerve that supplies the left arytenoid, there's a nerve from both sides. They go from the head down to the chest, go around the vessels of the heart, and back up. The one on the left side goes around the aorta, which is bigger. The one on the right side goes around the smaller vessels. So I think what you were trying to ask is, can you create a paralyzed arytenoid? And if you see one on the right side, there's usually a cause. Some sort of trauma, could be a wound. It could potentially be not a vaccination, but an injection outside of the vein, because the nerve runs right along where the carotid artery and the jugular vein run. Fortunately, most of the time it escapes, but occasionally it does not. And if you have a right side paralysis, it's usually very much more abrupt. But on the left side, where you see the change continuously, it's because that nerve has to travel a slightly larger distance, so it gets stretched when the horse's neck gets stretched out. And the left nerve, having to travel a longer distance, gets affected more readily. So people have postulated that anatomy predisposes it, and there's some information that would lend credence to that, because it's more common in thoroughbreds and it's more common in draft horses, big long necks, relatively. So the horses with relatively shorter necks don't have as high incidence, but you do see it in all breeds of horses. So if you're asking, is there any potential that the horse's genetic capability would increase these chances? Yes, but now you're, as Dr. Pierce said, the evaluation of throats is you're playing a numbers game. You know, that grade 3 ran and it did really well, but you'd go broke in a hurry if you bought all grade 3 throats, right? I mean, you know, you just can't depend on that happening. Occasionally one's going to beat the odds. But the incidence is not a direct correlation. So, you know, there are some people that feel that some families have a higher incidence. If you look at those horses, very often they're big horses. That might have something to do with it. But a short, scrawny, half-sized horse, it doesn't compete very well.
And we know, too, that the incidence goes up. You don't see very many foals. You do have a few paralyzed foals. You see a few in yearlings. You see more in 2-year-olds. And as they get older, you see the incidence goes up.
The other thing that he showed is that grade 3 horse was great at 2, but he disappeared at 3 and 4. This disease is not abrupt. It's not like you cut the nerve. The nerve slowly degenerates, so the muscle slowly degenerates, and many horses progress in the disease. And so the situation has gotten to the point where now with ultrasound you can look at the muscle and do a more complete evaluation, because eventually the nerve affects the muscle, which affects the arytenoid. And so there's information that can be gleaned from things such as ultrasound now. If you get stuck with one, you know, you want to see what's in the future for that.
Right.
You probably wouldn't go out and buy grade 3 throats.
You have a follow-up? Go ahead.
Well, when you say ultrasound the muscle,
Oh, you're opening up a can of worms there. That's Dr. Garrett. No, that's not a can of worms. It's really cool stuff. That's the future of it, I think.
But not
Not-
for sales. That's
not for
for
sales.
evaluation of horses in
Yeah,
performance.
not for sales yet.
Yeah, no, that's when you're trying to make a decision what to do when they're racing.
Dr. Garrett published a study in EVJ that predicted 98% of race horses that failed on the treadmill, over 80% predictability by upper airway endoscopy. So she and Rolf and Brett in our clinic have done a lot with this ultrasounding, and it's really in its infancy, and it's really pretty cool stuff.
But it's farther into the disease than you're
Right,
dealing with
right.
sales
It's
yearlings.
not-
It's
yeah.
not a sales yearling tool.
It's exactly right. Yeah, go ahead.
Only
Well, I gave a. Not necessarily. The question was, how do you you buy a weanling with a bad throat? Does that really mean it's going to be a yearling with a bad throat? Not necessarily. I did a study on 400 foals of pinhooks, and I presented to AP a few years ago. It was about 400 airways from weanling to yearling. Okay, so as you would expect, most of the epiglottises improved. The majority of them did. I only had one horse out of 400 that went from a 2A to a 3 bad, like paralyzed. 54% of the B throats in the group improved to a grade 1 or a 2A. So over half of the airways that were B throats. And that's why you can get away, if you're a game buyer, to buy a B throat in a foal. I know that 54% go to A throats as yearlings. So only about, and it's been a while since I gave the study, but only a couple percent get worse. Just 2 or 3%. Not many get worse. The majority of them improve. I don't know that. Can't answer that.
Alex has a microphone in the back, so if you have a question, just raise your hand and he'll try and get the mic to you.
Go ahead, Pat. Joe.
Pat doesn't need a microphone.
Dr. Pierce, question about the relationship of the soft palate to the epiglottis, just like a practical description of how they interrelate and what goes wrong when that thing lifts up, that soft palate. I've never really understood that.
Well, the horse is a nose breather. It's not a mouth breather, okay? The horses can't breathe out of their mouths effectively. Like that, they choke down. So they're functionally a nose breather. What happens is the epiglottis sits on top of the soft palate like this, just on top of it. And what happens is if they become displaced, and that ensures that they breathe through their nose. That mechanical situation there with the epiglottis on top of the soft palate. Once that goes below, they become a functional mouth breather. And it's not efficient, it's not effective, and they choke down. So it's a positioning thing. That changes a lot as the horse matures. Even some of the most normal-looking epiglottises will displace and have problems in training. And I don't think a yearling, I don't get too critical of a yearling that displaces anymore, unless they have, like I showed you, one of these short, flaccid epiglottises that I know affects performance. I can't get too critical of displacing yearlings because there's so many intangibles that are involved with that: positioning, pharyngitis, restraint, coughing, illness that goes along with that, behavior that goes along with displacing. And so I'm very lenient on horses that displace at sales.
The epiglottis's job is to cover the trachea when the horse swallows. That thing flips back up and covers the airway so the food goes down the esophagus. And the epiglottis's job when the horse is breathing is to hold that soft palate down so the air goes down the trachea. Keep the food out, let the air in. And Dr. Pierce is right that horses are nose breathers, and once more, they're obligate breathers. They must breathe every stride. So if the mechanics aren't working well, they can get out of kilter pretty fast, and you hear that noise he was referring to, like the blanket flopping in the wind. That's when the soft palate is up in the airway, causing turbulence and disturbing the airflow. The epiglottis is supposed to hold that down when they're breathing air and cover the trachea when they eat. That simple enough for you, Joe?
I knew he could do it.
So tell us a little bit about the tieback, the acupuncture, and the laser on these throats. Just so that they,
Well, I'm not a surgeon, but
does the tieback work, and when do you use it?
well, I guess more and more horses that aren't paralyzed, that are grade 3s, are being done. Early on, it used to be thought, Are there any of the soft tissue guys in here? Where's Embertson or Woody? Are they in here? Used to be thought that you had to wait until they became paralyzed or they would saw through and you probably know this more than I do, actually.
Well, I mean, I don't think we should get too deep into treatment as far as
Sorry.
what we're doing here for that, but if you define tieback's work as to have horses won the Breeders' Cup that have had a tieback, the answer is yes. Do all horses that have tiebacks have normal throats? The answer is no. Lasers are used for different problems. Each one of those conditions that he showed up there has a different treatment. It's not either a laser or a tieback, or you treat the specific anatomic abnormality. And I think we'll be happy to talk to you about those after the thing or whatever. We won't get through the session if we start talking
Yeah,
about...
we've got a lot to cover on the radiographs.
we don't allow questions that start with, I have a horse.
Yeah. And then the acupuncture, though, is interesting. We can talk to that offline. They do electrostim. It strengthens the muscles. I think that's much like exercise. You can't stimulate a paralyzed throat, paralyzed arytenoids, because it's paralyzed. It has no muscle.
No nerve?
No nerve. And so does it work? I think it's much like exercising, that you strengthen the muscle that does exist. And once that stops, it stops. So does it work? It doesn't make a 2B. I've never seen a B throat go to an A throat by acupuncture. I've seen some airways that don't quite meet conditions, but it's still a bad airway. Okay, let's go on now to Bart and talk about some of the new conditions of sales, which is kind of interesting.
All right, so a lot of concerns about what's happening. So where we were at before, you turned in your radiographs, and you hired a veterinarian to read your films. They reported to you, and you made a choice whether you wanted to buy the horse or not. And I don't know who started this, but somebody started handing out radiograph reports, and so it's all changed just a little bit. And so to make everything, to put everything on a level playing ground, Keeneland and Fasig-Tipton have both gotten together. And what we have here is really from the catalog from Fasig-Tipton. The Keeneland conditions of sale are not complete. Is there anybody here from Keeneland? All right, perfect. So I might refer to you here just a little bit if I need some help. Thank you. So from what I understand, and I've seen the conditions for this part, basically Fasig-Tipton and Keeneland agreed in principle to what this would say. Different attorneys wrote it up, so the wording is just slightly different. Is that accurate? Is that fair enough to say? Yeah, and as I've read them, they're pretty much the same. So now, when you turn your radiographs into the repository, that will be accompanied by a radiographic report. And the radiographic report that is turned in to the repository must be the same one that is being shown in the back ring and also at the barn. So the conditions state that a consignor warrants the accuracy, validity, and authenticity in all material respects of the repository information placed by the consignor in the repository. So in the event it should be determined that the veterinary radiographic report is not accurate, valid, or authentic in all material respects, and the veterinary radiographic report is deemed to be materially misleading regarding the condition of the horse, then the sale is subject to rejection. So if someone buys your horse based on the radiograph report that you gave them, they hire a veterinarian to read the films, their veterinarian disagrees with that report. They say there's something in there that wasn't on the report, then that can go to a panel. Any veterinary radiographic report which purports to describe or summarize what is reflected in the radiographs of a horse may contain and or be based upon subjective determinations. So everybody's going to have just a little bit of a different opinion, right? So not necessarily being dishonest, not necessarily being inaccurate. Everybody's got a little bit different opinion on what's significant. Written reports are not a substitute or the equivalent of a review of the actual radiographs. So if you want to know exactly what's in there, you need to have somebody read them. So this is some terminology that you'll see on some of the radiographic reports, and you know, everybody's got a little bit different terminology. Our practice pretty much uses the top one, NSA, no significant abnormalities, and that's unfortunately changed just a little bit. It used to mean that that this is a normal radiograph, that everything on there is the way that it should be. What it means now is there could be some changes on there, but I don't find them to be significant. Is that fair to say?
Well, I think so. It changed. I mean, you guys changed it. I mean, you would go to the veterinarians and say, "Oh, come on, doc. I mean, do you have to say that?" And then it got all the way to the point where you're selling nothing but a lack of ink. You know, the less ink on the page, the better off you are. No longer do the reports make much difference. So, I mean, as Bart said, the key thing is the significant. That's what's changed. It used to be you reported all findings, and then you had to make an assessment as to whether you thought it would affect the horse or not because it was a finding. And then all of a sudden, significant became subjective as well. And then some people were saying, "Oh, well, I didn't report that because I didn't think it was significant." And so it's gotten to the point where most bets are off.
And it used to be I could look at a report and know what's on that horse. Anymore, I look at a report and I cannot tell a consignor, if I'm looking at a report that someone else has done, exactly how significant something is, because the descriptions have gotten very brief and non-descriptive, basically. You know, you might have a chip. You don't know where, how big, or if you can take it out. And that's kind of just, it's been the trend, and it's because everybody wants less wording on their reports. And that's what we're seeing.
Okay.
It's also why
Can't hear you.
I didn't want to have an Obama moment. It's also why I think these changes have occurred in the conditions for that reason.
It is difficult when you remove a veterinarian from that relationship. So the person that read these is not explaining to you what's on the report. It creates some challenges. It would be hard for me to buy a horse in the back ring based on the report.
Yeah, but we all understand why it happens. It's because, especially in the mid-range part of the sale, it's impossible for some of those consigners to look at every potential horse. For some of the potential buyers to look at every potential horse. So it does facilitate the sale of horses in the middle to the end of the sale. Now, in the early part of the sale, when you got a lot of money on the line, people are more likely to have done due diligence. But in the middle portion of the sale, you have to trust. And
Go to the next slide, Bart. That'd be interesting. The next slide, I think.
Okay, so this is what happens. Within 24 hours, if you have a dispute, you find something on the radiographs that wasn't on the report, you file with Keeneland or Fasig-Tipton, make a written report that you want to dispute this. Your veterinarian has to also make a report of what the findings are. They'll give you a list of 5 veterinarians. It'll be pared down to 3, and I think this might be different at Keeneland. But basically, the purchaser's cost of arbitration, if they lose, is $1,500, and it's a $1,500 loss to the consignor, plus the entry fee, commission, just as if the sale had all been final. So there are some.
Yeah, technically, and this surprised me. I didn't know this, and it's with other conditions too. It's similar, but technically, the sales company can. If a horse is rejected because the vet report is rejected, then technically the consignor would have to pay all the entries and the commission to the sales company. I think, though, that it's up to the discretion of the sales company, according to one of the guys at Fasig I talked to, that it's up to them to actually enforce that, but it is in the conditions, especially if it was something malicious. That if you had $1 million horse that had a bad X-ray report, the consignor would be liable for that 5% commission.
So then, go ahead.
question back here. Stand up and yell, Jody, or use the mic at least.
Veterinarian's gonna write this report,
Yeah.
but then the consignor's gonna be held responsible, and if it goes to arbitration? What's the consequences to, and I hate to say this, but what's the consequences to the veterinarian? Is this to try to keep false reports from going any
I
farther?
suppose you could fire me, is one.
No, but I'm serious now, I mean.
Well, I'm serious too.
Why is everything the consignor? I don't understand that. Why is everything?
As the conditions of sale have always been, the consignor is responsible for all the information that's in the repository. Even the quality of films is the responsibility of the consignor, and the accuracy of the films and the report. It's always been that way, but now the report's added on top of
The
it.
consignor's responsible for announcing a cribber. The consignor's responsible for announcing originally.
But the veterinarian answers to you.
Right.
Answers to you. You
So
hire the veterinarian, you choose the veterinarian, and you choose the kind of work that that veterinarian does. And so, you know, you can probably go to Mexico and pick up a couple of veterinarians that, if they can write English, that are gonna write you some pretty good reports.
Did you hear that, Jesus?
I know Jesus could tell what they said. I'm not sure you could. But I mean, you could go someplace and find someone who will write you any kind of report. And so the consignor does have skin in the game here for what kind of reports go in. And it's very much like the absolute insurer rule of the trainer with racehorses.
And it has changed just in this short period of time. It's changed the way consignors and veterinarians are given a lot more thought in what they're writing on reports. I was on one, there was been one horse that was kicked back in the July sale.
It wasn't kickback. It just went to arbitration.
Went to arbitration. Well, it was kicked back and went to arbitration. And then there was one horse at the Saratoga sale that I know. So one horse in each sale. The first horse that I was on the panel, the three panel members, it was a majority 3-0, that they thought the vet report was accurately describing the horse. The one in Saratoga 2 weeks ago, it failed that 3-0, that the vet report did not reflect what was truly on the radiographs.
So can you tell us just a little bit about how that happened? So the 3 veterinarians are selected. You don't know who the consignor is. You don't know who the buyer is. You don't know the horse.
Right.
Is that correct?
Right.
So they give you the report, though.
They even blacked out the report and just didn't see numbers, anything. Read the report, put the films up, read the films.
Just the one joint?
No, the whole series.
The
The whole series of films had to be materially misleading in order to negate the sale. So I had check marks. The sale is rescinded or the sale goes through. Simple as that. And
So
check.
it's 2 out of 3, right?
2 out of 3, and both of these were 3-0.
So if you had a veterinarian who was a repeat offender, I mean, does Keeneland take any responsibility, or Fasig-Tipton, as
Well,
far
they-
as not letting him put
I
stuff
don't
in
know.
there?
I think in the task force that I was involved in, that was discussed. But really, the sales companies have, other than the client who hires the vet, who ultimately has the control over their veterinarian in the long term, but the sales company is the ones that have the teeth and the really the final say-so and who does what.
And I believe that both conditions do say that they reserve the right, to, if they find that it's intentionally misleading, it wasn't
Right.
just an error, that they may go further and keep people from selling horses.
Right.
Question?
Yeah, please
Yeah,
do.
please.
Tommy wants to stick his head out of the foxhole.
will there be sanctions against repeat offenders? And specifically stated in the condition is sanctions may be enforced by Keeneland on any party, consignor, owner, or veterinarian who is seen to be persistently abusing the system, either through excessive arbitrations or by excessive misrepresentations noted in the study. So, yes.
So the answer is yes.
So even a buyer who has buyer's remorse and repeatedly tries to get out of the sale, we're trying to prevent that too then?
And I'm hoping that's where it doesn't lead to, honestly. I hope it doesn't lead to this buyer's remorse, buyer's negotiating tool type thing. We'll see. The verdict's still out.
The question I have is where is the line going to be drawn here as regards, are we going to have spurs or a sharpening of an edge or mild sesamiditis versus severe sesamiditis?
That's going to be real interesting to see.
Yeah, and who's going to determine that?
Right. That's going to be what a spur to one is not a spur to the other. Is it sharp? Is it significant? So you are going to have shades of gray. Sesamoiditis, is it mild? Is it truly mild, or is it moderate?
And when is it turned backable?
That's a good question. Whenever your veterinarian, the buyer's veterinarian, agrees to write that I disagree with this report, and you have the right to return this horse. That's the beginning of it.
But it's, Scott, it's not, you can't return a horse for the lesion, right? There's no bone warning. You can only, it's only,
No, it's all-
only
it's-
because of the report's different.
Yeah, it's not it's how the report is described. The radiographic lesions are described on the report. Period.
Who chooses the panel of three?
Both parties.
Yeah,
The buyer, the seller, and then the one who chooses the third.
It's Tommy, I mean-
the sales company comes up with a list of 5, right?
And-
And then I think,
Yeah,
each
that's how
kind of
each
jury-
party
jury
knocks
selection.
one off, just like the scope thing. Each party knocks one off. And Frank, you had a question or comment?
Well, I was just thinking, like, doesn't this kind of drive all veterinarians? Now, if I'm a veterinarian, I'm reading it, and I think, well, it's probably mild, but I better go ahead and put down that it's moderate, because I'm going to be, doesn't it push them on to grade them harder and harder to do that?
I mean, honestly, for me, I have to say, I don't think I'm personally going to change how I've always read reports.
Well, that's because you grade so hard.
Okay. Thank you.
Well, then you're in good shape.
But it's really to stop the offenders that aren't writing anything on stuff that is significant to the majority of veterinarians. And I think that's where this is trying to lead. The tendency is for a veterinarian to write something versus not writing something now. Yes, I think that is true. But I don't think it's from a personal standpoint, and I think that all of us have gotten a little less wordy over the years, and trying to say this really isn't significant to the horse. And I think of that almost on every report I write. If I'm writing something, okay, I have to think, now if this went to a panel, how many people would say that this is significant? I mean, that goes through your mind every time. So you spend a lot more time thinking about that, and there's going to be some that you write more on and some that you don't, but it's what is perceived as being acceptable. And I think there's going to be a gray area there right now.
Well, as a consignor, what we do is if we have a customer sends in a horse, as you know, that sends in a vet report with it, we'll give the grades and we'll say, with an R beside it, off a report. Now what you're saying is we're going off other people's integrity, trusting their integrity, and we're going to be held accountable for all the integrity of any veterinarian that happens to send a report in.
No, I mean, I'm sorry. That question has come up. If I were you, I mean, I'm not in the horse selling business, but if someone comes to you and says, it's already been vetted, this is the report, I'd have them sign something that they took the responsibility. Because if they want you to produce the report, you can. If they don't want you to produce the report, and they do it, then they ought to sign something that says that they've taken the responsibility. I mean, I would think that would be logical.
Well, that's good, but what if they don't have any money when we get in a fight? Anyway, I think we're heading in the right direction. I think this is probably going to be a good thing in the long run, because being honest is I think the key to everything.
You pass the microphone right back behind you, the lady in black. And I agree with you. I think the people who have written honest reports all along have nothing to worry about. I don't think this is going to change much for most people.
My question is this: when you get that report, can that be from any accredited veterinarian in the United States, or are there any? Because all vets are not created equal.
Yeah,
I've spent enough time around you all to know that.
There's no sales accreditation. Just a DVM, licensed DVM can write them.
So I mean, it could be a small animal practitioner, and
Good.
Could be.
so maybe there's something. Not to put the emphasis on the veterinary profession, but I mean, maybe there's some things that could be done. Okay.
Buyer needs to use their own vet and do their homework. What do
As far as the veterinary profession, I'll tell you where that's been, because it's been up the ladder and back down. If it reaches the level of fraud, like Jody and I were talking about, if it reaches the level of fraud, you report it to the state association and they can take action.
You mean like losing licenses?
Yes.
And has that happened
Losing the
in
process.
these cases?
We're in new ground here. It's never happened. So, but if it reaches the level of fraud, it could be reported up. But most of the things that we're talking about are not frankly fraud, because you're going to lose the fraud argument whenever Tommy calls you into the office and lines you up in front of the panel. I mean, you'll lose those fraud ones. So.
But I was also just concerned about the level of competency, because some people have different competitive advantages.
I don't know what you do. I mean,
You have to know and trust your veterinarian if you're presenting a horse for sale.
Okay, we're gonna take one more question, then we'll move on.
Jim had one.
What does the panel think about totally abolishing the reports in barns, and consigners then don't have the responsibility if you don't have the reports, and let vets for the buyers go to the repository and do their homework? Would that ever happen, do you think?
I think you have, depending on how this goes, I think you have the potential of going full circle here, back to where we were. If this doesn't work out good, which I think it will work fine, because the degree of malicious reports is very small. It's like the one I looked at had slight sesamoiditis. Well, it was NSA'd on the report. And there wasn't one of us on the report that would have mentioned that either. It had a little sesamoiditis, but it wasn't significant. So that's what you're going to get into. Not in anything malicious deserves to go back. But at the same time, it depends on how this whole thing goes. I honestly think this whole thing could go full circle.
I think the veterinarians would be fine with the reports going away. We've just been told that they won't, because they're a marketing tool. And for you guys that are selling, it's very valuable to you.
I've known you for 20 years. These reports have cut my business 50%. So what do you think I want to have happen? I mean, come on. No, the buying. It will end up, honestly, because we don't want you to get a horse back. It's probably going to end up in a little bit more writing than I used to, but not much more.
But we may be better off. No revolt.
I don't know.
Well, it would be the best situation, because then you're really truly getting the opinion of the veterinarian that was working for the person that's purchasing, which would make sense.
But that's part of why we're here tonight, right? We're going to explain a lot of things that, as we go forward, what does the writing on the page mean? So, and I think that's important, and that's where a lot of it drops. So you just see something on the page, you don't know what it means, and it's like Dr. Brown said, it's ink. and it's enough to keep people from buying the horse. So, all right, we'll turn it over to Dr. Spike Pierce and move on.